to your stations, which is Let's Talk NCLEX. We get to go over our question for this week, which turned out to be super, super easy for you guys. And there was a very little variation, which I was happily surprised about it, because that means that you guys are learning and you guys are progressing. Now, what I will say though is that this week it was a level 1 question, so you should have gotten it right. But if you didn't, we're going to talk about more level 1 types questions. And for this Let's Talk NCLEX, I'm really happy because I was able to incorporate some of the questions that I get from you guys throughout the course of the week. So I know that these questions will sound familiar. Hello, hi everybody. Yes, I know the answer. So this is Let's Talk NCLEX. Here we go. You guys know me. I am Regina Callion. I have the pleasure of being the NCLEX instructor here at Remar Review. I love to share what's in my brain. I'm going to transfer what's in my brain into your brain, and then we'll all be ready to pass. Check our website out, remarreview.com, where you can find, oh my goodness, we have the NCLEX reviews. Hi, Lisa. We have resources. We have the inspiration, the motivation. It is all there on the website. If you have a couple minutes today, hit that website up and check it out. We have some amazing products like the DVD self-study package. Hey, it is the world famous DVD self-study package. Do you have this? If you have this, just put hearts on the screen. If you have this package, it is changing lives. And there is a discount code for you right now. If you use simply Remar Nurse, you will get a discount on the products. You will get a discount on the products. Hello, everyone internationally and right here with me in the United States. Already the numbers are climbing, and we're at 150 live right now, which is incredible. But we do it every week here for our Let's Talk NCLEX segment. So you guys, you must like the information that we go over. I see your testimonial. Jake, is that how you say it? Hi, Regina. I passed NCLEX. Can you put that up? Oh, man. Hi, I passed NCLEX on Tuesday. Thank you so much for your amazing resources. How did you know I was going to be on here today? You guys wait till I pop up and then you blast it out that you're passing NCLEX. I am super excited because that is what we do here. We help you pass NCLEX, and I just need to see your video testimonial. Go ahead and share it. Go ahead and share it, and you will get our Remar Nurse t-shirt. You deserve this t-shirt. People ask me all the time, I want this t-shirt. It's super easy to get. Like, look, this is the lady t-shirt. This is the lady t-shirt, and we have one for the guys. Do you guys want to see the guy t-shirt? Because I hardly ever show it, but we do have one for our fellas, and I want to thank Cyanotic for putting this in here for me. This is the men one. Like, it's super big. Like, the Remar Nurse is like, boom, it's right there in your face. So all of our fellas, we have Remar Nurse shirts for you because we know that you represent us as well too, and we're so thankful to pass NCLEX. You guys are already on the road to passing NCLEX. So pass NCLEX, tell your story, be our testimonial. We have some incredible ones. I know you guys see them on Facebook and YouTube. They are so inspirational, so motivating. And I want to, yes, we will pray. We will absolutely pray for you guys who are testing soon. We know that time is coming, but you've been prepared for it. And speaking of students who are preparing, I wanted to take some time this week to do a student spotlight to someone who is actually still studying for their exam. And I just wanted to encourage you guys by this student. Her name is Future Nurse Dyna. And she put a post on the Facebook page, and it really kind of touched me because I saw her there with her daughter. And she said about the DVD package, "This is my life." Regina, thank you. I can't wait to share my testimony. I could not afford it. One of my friends blessed me with the products. I'm learning a lot. I even hear you in my sleep. Thank you. Thank you. Well, future nurse Dyna, you're in the right position. You're doing the right thing. You're studying the right products. And this is your time. This is your time. So thank you so much for sharing where you are in your study process. You and that wonderful, beautiful, healthy baby that you have. We are all praying for you, and we are excited that you have made yourself a priority. It's hard when you're a mother, but you've made yourself a priority to give NCLEX your all, and that you're learning, and you feel like you're making progress. So thank you so much. Another real testimonial, like this one is hot because it just happened. And so this should encourage you guys. Her name is Nurse Kanesha Means. And she says this. She says, A, use the DVD self-study with quick facts. Test it, 8-9. All right. That's like future. That's like, this is happening right now, you guys. She just passed NCLEX PN, and I didn't put it on the slide, but she passed it in 85 questions. So, wow, I had to let you guys see her and know her because she is amazing and incredible. Just got her license. Nurse Kanesha, what are you doing now with all your free time? So she is our motivational practical nurse for today. And we have a registered nurse. We have a registered nurse who just passed. Her name is Nurse Lorinda White. Got the RN, got those two big letters behind her name. And I loved her post because she said she was out of school for 8 long years. 8 long years. That is, remember when I came on earlier this week and we looked at the stats of repeat test takers, how it went from 86% to your first time down to 34%. Remember that? So she been out of school for 8 years and she was able to pass her NCLEX RN with 76 questions. So there is no excuses. There is no excuses. There is no limitations except for the ones that we put on ourselves. Sometimes you see these amazing testimonials and you think, that's not me. That won't happen for me. But it absolutely will. It will happen. Take the limitations off of yourself. You can do this. So congratulations to both of you guys. Thank you so much for studying with me. I have such a great time. I have such a great time here. So let's get into it. I just got to ask, like, who's next? Who's next to pass NCLEX? I know we have some people testing this week. Who is next to pass NCLEX? And then don't forget, you got to tell the story. You got to tell us your story, how you pass. I'm stressing that. I'm stressing that because literally you guys are my testimony. Nobody wants to hear my story over and over again. People want to hear the latest and greatest, and that's you guys. So Cheryl says she's next. Yes. I'm waiting for you guys. I'm waiting for you guys right here. Okay, so let's talk NCLEX. This is what we've been waiting for. This was the question of the week. I know it was super easy, but I still want you to participate fully because you may learn something. Okay, so here we go. This was our scenario. We had a nurse is caring for a client with end-stage congestive heart failure, CHF. After breakfast, the client lays down in the bed and becomes cyanotic, tachycardic, and short of breath. The nurse is the first one to the room and notices that the oxygen is flowing as normal. What is the initial action of the nurse? I'm going to read it again. A nurse is caring for a client with end-stage CHF. After breakfast, the client lays down in the bed and becomes cyanotic, tachycardic, and short of breath. The nurse is the first one to the room and notices the oxygen is flowing as normal. What is the initial action of the nurse? Here are our choices, everyone. Number 1 is going to be increase the administered oxygen. 2, elevate the head of the bed. 3, notify the physician. Evaluate, number 4, evaluate the triggers from breakfast. What do you guys think? This patient has CHF. They are short of breath. Is it prudent for us to increase the administered oxygen? What about elevating the head of the bed? Notifying the physician. Do we need to call the doctor? Your patient is short of breath. Your patient is tachycardic. Patient is cyanotic. Or evaluate the triggers from breakfast. I'm laughing at you guys today. Okay. I think you guys know the answer to this one. It is, of course, Dyna, number 2. Yes. Yes. No, it's 2. Yes. Elevating the head of the bed. Yes. This was not a trick question. This was very straightforward. Okay. And I like that it was straightforward because you know what? When you guys are able to commit to an answer and go with your first mind, is so much better. And when you guys are able to understand the pathophysiology behind a diagnosis, these things are very easy. So we know that congestive heart failure, we have a problem here of fluid buildup. Yep, we have a problem of fluid buildup because the kidneys are not getting rid of the fluid. The kidneys cannot do their job because the heart is not pumping enough so that all the organs get their nutrients. So the kidneys have to start slacking off, and then the fluid doesn't leave, and your patient is just stuck with a whole bunch of fluid. So elevating the head of the bed for a patient who is having shortness of breath when lying flat is going to be the most important thing that you can do. Now, what is it called when a patient gets short of breath when they lie down flat? What do we call that? There is a medical term for it. I need to see it. All right. What do we call that condition? And also, you guys that have the DVD package, I want you also to tell me what is the most important laboratory value for a client with congestive heart failure. What is that lab value that we want to see soon as we find out that this is the diagnosis? Yes, Karen, I see it. Karen said it. Who else is saying it? Lovely. Yes, you guys know what it is. All right. If you're reading the comments, then you're getting the right answer. We call that orthopnea. Yes, love it. We call that orthopnea when the patient cannot lie down without getting short of breath. So that's why when you're doing, and I say this all the time, that's why when you're doing an admission assessment on your patient, you want to ask them, especially if they have a heart history, you want to ask them, where do you sleep at night? Where do you sleep? That's important because if they tell you that they sleep where, if a patient tells me I sleep in a chair, I haven't slept in my bed in 10 years, I'm going to say, what? Why are you sleeping in a chair? And they're going to say, because I get uncomfortable. I can't breathe. I'm restless when I lay down flat. Well, that's a sign of congestive heart failure, right? Okay, so you guys got that. Good job, geniuses. Now, the next question was, what is the laboratory value that we correlate with congestive heart failure? That is very, very important to us. I see it. Yes. Very good. Yes, you guys are on a roll today. We know our congestive heart failure. Perfect. So I see it. The laboratory value that I'm most interested in for a patient who has congestive heart failure is that pro-BNP. Exactly. Pro-BNP. And the number that we are looking for is anything greater than what? Anything greater than 100 lets me know that somebody has some serious congestive heart failure. Perfect. What else did I have? I'll make sure I have like a little mini review of my notes. Okay, so congestive heart failure. We're rolling with congestive heart failure. What kind of medication shall we give someone who has congestive heart failure? Now, think about what's happening in the body. Remember, I said this is an issue of what? Fluid buildup with congestive heart failure. So say we have a patient who has a pro-BNP of 400. If they have a pro-BNP of 400, what kind of conditions what kind of medications are we going to be prepared to administer? What kind of medications? I'm looking. This is how you prepare for NCLEX. You just talk your way through it. Yep, you just talk. And when you're studying a topic, you sit down and you say, okay, let's talk about renal failure. What are the signs and symptoms? What laboratory values are important? What medications should you administer? This is how you do it. So I see it. Yes, if a patient has congestive heart failure, we are going to want to administer diuretics. Yep, furosemide. Exactly. We also will give them, I like that. We'll also give them some oxygen. Yes. We'll also give them morphine for pain. You guys are replicating the DVD package with me. I appreciate it. We're going to give them some morphine because it's very painful, right? When you have fluid in your body. So if you have right-sided congestive heart failure, you're going to have that edema in the body, and it's going to be very painful to your patient. So this is the treatment. This is the treatment for congestive heart failure. Absolutely. I love that. Good job. You guys are doing great. Furosemide, morphine, diuretics, also digoxin. Digoxin as well will be given because digoxin really helps the patient to, it helps the heart to perfuse more effectively. Okay? Yes. Excellent. So that was our NCLEX question for the day, but we're not going to stop. Okay? You guys seem to have a good handle on this topic, but you know what? I got some questions this week that you guys may be familiar with, or you guys may have some additional insight for me. So let me put my notes here. Yes. Okay. Thank you. I get live interaction notes right now. Okay. So somebody asked quickly, does the DVD package come with a calendar? Yes. And I was given this calendar to show. It does come with a 6-week calendar for you guys who have it, who don't have it, and you want to know. So we outline the topics that you study, and congestive heart failure is one of those topics in here. So over 6 weeks, you will be able to go through every topic with myself, and we break down the disease processes for you to be able to know. Okay, so let's do it. Let's do it together. All right. Now, another question that I got this week that I had to sit down and think about and grapple with was this question right here. This is our Ask Remar segment. It's new. It's called Ask Remar. Okay, it's Ask Remar. So here we go. The first question I got was this. And I'm not going to say who it's from. This is totally anonymous when you guys send me emails. So here it is. Okay, so a student asked, can my employers assess my NCLEX score by my Social Security number? Can my employers assess it? So like if you're working at a job and you are, your employment is pending, if you pass, your boss will not be able to know your score. Okay. Your boss will not be able to know your score. You won't even know your score. Like you won't even know what it is. You will just be able to be notified whether you passed or failed. And that's something that it will come directly to you. And the only way that your employers actually could verify whether you passed or failed is by searching for your license. So if they knew you had a test date and they went to search for your license and they did not see one, then that is how they would know that you did not pass your NCLEX. So it's still a conversation that you have to have with them. Okay. All right. Okay. Ask Remar. The second one was this. When delegating tasks to a nursing student, is she superior than the LPN? Whoa. Man, I wrestled with this question, not because it was a difficult one, but just because the perception of LPNs is sometimes so inappropriate, where people believe that LPNs are lesser forms of nurses. And they're so not. They are so educated and so skilled. And I've seen LPNs who can literally run circles around RNs, but we get caught up in, what do we get caught up in? Titles? What is that about? I mean, so the question is asking basically, is a RN student higher than an LPN? No, you guys know, absolutely no. No, that is going to never be the case. A student of any magnitude will not be higher than someone who has a license. So your LPN is a licensed nurse. They have skills, they hold responsibilities, and your nursing student, they're basically a nurse's aide at that point. They have no practical experience, skills, or license. RN student, IV medication, okay? Because here's the thing, the RN student is working under someone's license. So, well, in the real world, does this happen? Yes, all the time. Even for myself, I had the most relaxed preceptor you ever will imagine. And literally, he trusted me so much that when I was a senior, he would pull the meds for me and he would, oh, I better not tell this story. Anyways, let me say this. No, the answer is going to be no, okay? When delegating tasks to a nursing student, she would not do IV medications for NCLEX, right? Because it is under the license of the nurse that she is practicing. All right. Okay. I'm going to keep it real with y'all one day, but this is not the day. All right. Okay. Next question. In Quick Facts, this was a question about Quick Facts. In Quick Facts, it says no medication can be added to TPN, right? So they're verifying that. No medication can be added to TPN. However, because it has a high glucose content, can we add IV insulin to it? I think no, but I just want to be sure. So the student is asking me, basically, because TPN is mostly dextrose, right? And it will raise the patient's blood sugar. Is it important for us to add insulin to the TPN? Is it important for us to add insulin to the TPN so that the patient's blood sugar can remain normal? And in Quick Facts, it does state, do not add any medications to TPN. And that is true. We don't want to add any kind of anything to a TPN bag. All right. When it comes to you, it will already have the list of ingredients inside of it. Nothing should be added. And I know we're answering them kind of quickly, like saying no. But if you have not heard of any of this stuff before, or if you weren't educated here in the United States, or if you've been out of school for a long time, these things sometimes can get confusing. So it's nice to be able to come on here and just clear up some misconceptions or things that are done differently. So it's okay. It's fine to ask questions here. If your patient needed supplemental insulin because the TPN was making their blood sugar high, we would give that insulin probably subcutaneously. You wouldn't give it IV. Okay. All right. Next question. So, all right, we're asking questions here. Good morning, Miss Regina. I am coming close to taking my NCLEX exam. I wanted to know at SATA questions, are we allowed to choose one answer or are we allowed to choose all answers? Or does this take effect next year? So that's a very great question. There was a lot of talk about this when NCBSN put out the notice that select all that apply questions can be one or more or all of the choices that you see on your NCLEX exam. And when I looked at that statement from them, it appeared that this was a present standard for the NCLEX right now. So I know we're looking forward to the changes that are coming in 2019 for the NCLEX RN. I know we're looking forward to knowing all of those changes, but right now with the select all that apply questions, You can choose one answer that could be correct, or you can choose all of them that are correct. Okay. All right. Here we go. Here we go. Miss Callion, is it a safe practice in the USA to shave or use scissors to remove hair from a surgical site? The website has been giving me missed answers. In Jamaica, we shave, but want to make sure I have the correct answer. See what I mean? I love that we are an international community, because when I went to look at this, I got to do some research, and I got to read some publications and really be able to give the correct answer. Do you guys know, do we shave or do we clip hair here? I want to see what you guys know. Do you know what we do for our surgical practices? What are the best? What is the clinical standard right now? And what's the best for our patient? Don't we shave? Don't we shave? Yeah, there are some people who are shaving, but actually you guys know that we should actually not shave, okay? We should not shave our patients. We should clip or trim the hair, and only the hair that is directly involved with the surgical site, okay? So nobody should be shaving just because what happens is with the razor, of course, there could be a potential for infection. Basically, if you break the integrity of the skin, you are exposing yourself and exposing your patient to potential pathogens. So the standard should be to clip the hair when necessary. So yes, it's common, because you do see some people still shaving, the patient, or asking the patient to shave. And I know some patients, they get so worried that they shave their entire body. They just want to be appropriate and as sterile as possible for surgery. So here, for your exam and for practice, we're going to clip our patient. Okay. Now, before I let you guys go, I'd like for us to do another level 1 question, if that'd be okay with you. And it's just to ease us into the weekend. So here is the question. Here we go. A nurse is ambulating a client diagnosed with a left leg DVT, deep vein thrombosis. The client has orders for twice a day ambulation. After walking 6 feet, the client experiences shortness of breath and chest pain. What is the initial action of the nurse? I'm going to read it again, just so we're on the same page. A nurse is actually ambulating a client diagnosed with a left leg DVT. The client has orders. The doctor wants the client to ambulate twice a day. After walking 6 feet, the client experiences shortness of breath and chest pain. What is the initial action of the nurse? Here are our choices. 1, notify the physician. 2, put the client on strict bed rest. 3, rest the client, but afterwards allow for ambulation. 4, administer prescribed analgesic. Should we call the doctor? Let him know. Put the client on strict bed rest. Rest the client. We know they have a DVT, but afterwards allow for ambulation. Or 4, administer pain medication. Oh, I see some controversy here. Wow. Really? You guys? Really? Oh, this should have been my question of the week. So I like Natty says, never call the doctor first. But I see a lot of 3s, and I see a lot of 2s, a lot of 3s and a lot of 2s. One number 1, notify the physician. And I see some number 4s. This is very interesting. This is a level 1 question. Level 1 means that what is being presented to you is directly related to the clues that you're given, directly related to the diagnosis, directly related, one step into the nursing process. So here we are given the diagnosis, right? Here we're giving the diagnosis. So a client is diagnosed with a DVT. They have a clot in the leg, but the doctor wants them to ambulate, which is kind of a new thing that you see with management of patients who have DVTs. Because remember, before time, if a patient came in with a DVT, then they were put on strict bed rest. There was no ambulation at all. Like, that was just not something that you did. But now it is believed that once patients have their anticoagulants on board and their labs are pretty stable, it is justifiable to have that patient to ambulate. So here we have a situation where an order for ambulation has been written for the patient. Let's look at the question again. Somebody asked to see the question again, so somebody might be joining. Here we go. A nurse is ambulating a client diagnosed with a left leg DVT. The client has orders for twice a day ambulation. After walking 6 feet, the client experiences shortness of breath and chest pain. What is the initial action of the nurse? What is the initial action of the nurse? Here are our actions. Number 1, are we going to notify the physician? 2, put the client on strict bed rest. 3, rest the client, but afterwards allow for ambulation. 4, administer prescribed analgesic. Now remember, this is an NCLEX question. So you know that it is all about what? What is the entire test built on? This is the information that you may or may not get at another person's review. But Remar review, I'm going to tell you exactly what I know. And what I know, I don't know many things, but what I do know is about NCLEX. So the NCLEX exam is totally based on patient safety. Exactly, Stephanie. I love it. It is totally based on patient safety and your client needs. So in this situation, what is the safest thing for the nurse to do? The safest thing. Because sometimes if you don't know, like if you don't really know, you can always fall back on safety. So our choices here, if we call the doctor, okay? If we call the doctor, you have a patient, they're up walking. It says after walking 6 feet, the client experiences shortness of breath and chest pain. Okay? Shortness of breath and chest pain. That's where we're at. That's all we know. So if I go over the choices with you, if I break down this question, here it is. Number 1, if I call the doctor, because remember, how is my patient? My patient, after walking 6 feet, they have shortness of breath and they have chest pain. If I call the doctor, then that means, because this is the initial action. So this is what is the first thing we're supposed to do, right? So if I call the doctor first, that means I have not addressed my patient. That means that my patient could still be up walking around. Is that a great thing? No, that's a terrible thing. Because when we hear shortness of breath and chest pain for somebody who has a clot in their leg, that means that perhaps the clot has done what? Why do they have chest pain? Why do you have chest pain? You have a clot in your leg. What's going on with you? Could your clot have dislodged? Is it a PE? I don't know. But if I call the doctor and say I call the doctor and the doctor says, what's the patient doing? I'm like, I don't know. He's up in the bathroom or he went to the vending machines. Am I a safe nurse? No, absolutely not. Calling the doctor is not going to be the initial action. It is not going to be the initial action, my friends. The correct answer, because that was like, so if you knew that, right? If you knew that it wasn't call the doctor, then you have to know, you must know, the most prudent thing to do is put this client on strict bed rest, because you don't have a choice. You have to do that until you find out what's going on. You have to know where the source of the chest pain is coming from. So even if you rested the client, if your idea was just, oh, go sit down, have a couple minutes, and then we're going to get up and go back to our ambulating orders. Oh man, if you pick that on NCLEX, it's a scary situation, because that means you are not a safe nurse. Like you didn't even think to call the doctor. Calling the doctor, I think, would have been probably the only one that I would have accepted. That was really wrong. Okay. And of course, administering the pain medication is not at all going to address your client needs. The safest thing for the nurse to do is to put the patient on strict bed rest. That's a level 1 question for you guys. Safety first. Okay. So if you got it, very, very good. If you did not get it, go ahead and look up DVTs, and also the nursing implications, nursing interventions, potential complications for such a diagnosis. I love studying with you guys. I hope you enjoyed our segment. Okay. You can connect with us at remarreview.com, where you can find more of my amazing NCLEX resources. Hey, did you guys know that I come to schools? Did you guys know that I come to schools and I do exactly what I do here on Facebook Live? I'll do it for your entire class. So send me an email if you want to make that happen. My email address is support@remarreview.com. And I promise you that your NCLEX scores for your school will go way, way up, because we sit down and we really talk about the information. I also have a phone number. It is 855-NCLEX now. And there you can also get information about, hey, Regina, what's best for me? What's best for me? I've been out of school. Hey, we had a testimonial of someone who has been out of school for 8 years and just passed their NCLEX RN exam. So this is the place where we are studying, we're critically thinking, and we are passing NCLEX. I hope you guys enjoyed this segment. I will be back on again Monday for our Monday motivation. And you guys might have noticed I got some new hair. Woo! It is because I will be in Las Vegas next week, and I will also be in Phoenix, and I hope to take you guys with me. I'll do a live blog. It's going to be so amazing. Have you guys ever been to Las Vegas before? Have you? It'll be my first time, so I will be super, super excited to do my lives from there. And if you want to study with me, look out for us on Facebook, and we will be able to go over some more NCLEX information. Our class motto for 2018, do you know it? It is, we can, we will, we must pass NCLEX. We can, we will, we must pass NCLEX. You're calling for Mark? Really? You're calling for Mark? You guys want to see Mark? Somebody said, where's their spiritual leader at? Where is the spiritual leader at? Yeah. I see the question. Yes, I will be live Monday at 12 p.m. Eastern time. But if you want to know for sure, just connect with us on the Facebook page, okay? Just connect with us on the Facebook page, because we always put out exactly what time I'm going live. So I guess I'm bringing up a special guest today. I'm going to introduce, because the people have called for a special guest. Our Friday special guest for Let's Talk NCLEX is someone who has actually never and probably will never take the NCLEX exam, but we'll still keep him around. He's still very important to us. Mark Callion. They've called for you because they knew that you were here somewhere. Okay. They knew that you were around. And they just figured that you were around. So this is Mark Callion. I'm not sure at all what you wanted him to do, but I guess you just wanted to see that he was alive and well. Here he is.
I'm here. And I have something to say. All right, so listen, all this week, while we've been in the office, we've been having two jobs here. So here at Remar Review, we've been holding down NCLEX and giving you guys content and customer service and all of those great things. But after that, we would leave the office and go to our vacation Bible school.
Oh, yes.
This week we're doing VBS, and it's been so amazing. And I have to tell you that yesterday, we're doing the theme of Noah's Ark, and I put on the whole costume, the whole get up of Noah, and just ministered to the kids and to the families. So Regina, she is an NCLEX instructor for you as adults, but also after leaving work, after the office, she has the little kids from like 2 to 6 years old that she's working with and ministering to. And so she's just a teacher all around, and the gift is there. Mm-hmm. But I want to say this is the word that I'll leave you guys with today. On yesterday, as we were teaching about Noah's Ark and talking to the kids one-on-one, I have the older kids from 12 to 14 and up. 14 and up are my group. And so I was talking with them, and then one of the guys, I was explaining about Noah's Ark and how the world was covered with water, and how the wicked people were essentially drowned, and the symbolism with that in baptism of how going under the water and what it means to let the old man die. And one of the kids there, his name is Tony. I won't give you his last name, but his name is Tony. Really smart guy. He was like, "Hey, can I be baptized?" And I was like, "What? You want to be baptized?" I didn't say like, "Hey, you should be baptized," or "We're having a baptism." He says, "Can I be baptized?" And what I realized then, by how easy it came to him, like, okay, this is what I need, is that the prayers that we've been doing for the last 3 months for the Vacation Bible School, before the kids came, before we bought any supplies, before the flyers went out, before the invites went out, we were praying that God would move specifically for this event, this occasion. So what I want to say is this. We have a lot of people that say, "Hey, I'm testing tomorrow. Please pray for me." What I want to encourage you to do is make sure that you're praying from the get-go, right? Mm-hmm. So pray early on some things. It's a benefit and a blessing to pray early. When you know you want to do something, pray God's will over it, so that when the time comes, you're already in position to be in God's will. We pray for you all the time. We pray for you every day. Our staff, we pray for you on Mondays. But I just want to encourage you to pray early and pray often. That's the word.
Okay. No, you can't leave.
I know I can't leave. That's the word.
They are saying you think you're going to get on here and walk away without praying. I won't have it. I won't be answering those emails.
You say, listen.
Yes.
We were so close.
I won't have those emails sent to me.
Man,
listen, you have to pray.
Right, listen, we're going to pray. We're going to pray. Mm-hmm. All right. But with the ark, with the example is that when the door is shut, it is shut. So make sure that you pray on the front end. All right. Make sure you pray on the front end. Okay. We love you. We're going to pray for you. We're going to pray God's covering, but we want you to pray early, often, and on the front end, because you never know when it's too late. And I might be talking about NCLEX, but I'm really talking about your soul right now. So let's pray. All right. All right. Father in heaven, thank you for just an opportunity to come before your people by request and to minister to the needs that are ever present. First, Lord, we want to ask, Lord, for the forgiveness of our sins, because we want to be right before you. So that when we come to you, we can ask for all of the good blessings that you have and that you were just waiting to give. You want to bless us more than we want to even ask for your blessings. So we thank you for being a loving God, a kind God, and one who knows all of our needs. Lord, at this time, there are your children who are preparing for this test, this examination, this life-changing event. I ask that you would continue to be the shepherd of their lives and give them guidance and give them peace as they go through this test. It is only a test, and you have something better for them on the other side. Help them to go through with courage, with bravery, and help them to do the diligent work so that their studies and that their efforts might be honored on the other end. Also, Lord, there are individuals that have issues at home with the marriage and with the household and with the children. School supplies are short, and they're getting ready to send their children back. I ask, Lord, that you would open up the windows of heaven and pour out a blessing so that there is not room enough to receive it. This is my prayer, Lord, that when it happens, that they're able to give you the praise, the glory, and the honor. In Jesus' name we pray. Amen.
Amen. Thank you guys so much. Thank you guys so much for Friday. Let's Talk NCLEX. Thank you, Elder Mark, for being here with us and praying for us all. We so need that prayer going into the weekend and preparing for the test, whatever it is. It might not be NCLEX, it might be something else, but whenever that test comes, we have prayed that we will be ready and we will surpass it. by God's grace. So have a great weekend, everybody. Bye.